Hello and welcome to today's webinar, The Role of Referential Matching in Master Data Management. Before we get started, I'd like to announce a few brief housekeeping details. Today's session is being recorded, and an online archive of today's event will be available a few days after the call. You will receive an email from AHIP that will ask if you would like to receive the archive. Please respond to the email if you would. I'd like to remind you of AHIP's antitrust statement and ask that you reference it at the bottom of your screen. The antitrust statement prohibits us from discussing competitively sensitive information. Please keep in mind that you may ask a question at any time during the presentation by typing your question into the question and answer box located on the right side of your screen. Once complete, please press enter. And finally, please refresh your screen at any time if you are having trouble seeing the slides presented in today's webinar. We're very fortunate to have John Case from Verado, Brennan Cosley from Blue Cross Blue Shield of Tennessee, and Nathan Funk from Optum Advisory Services with us today. John Case is Senior Solutions Architect at Verado. He joined Verado from IBM, bringing 10 years of experience working with initiate systems, identifying matching and MD technology, and 20 years of experience in the technology industry. His experience in information management and master data management has spanned roles in implementation services, pre-sales support, solution architecture, and product management. He has consulted and delivered solutions for clients across many industries with a particular focus on healthcare, insurance, and financial services, from Fortune 500 companies to community hospitals. Brennan Cosley is a biostatistical research scientist at Blue Cross Blue Shield of Tennessee. Brennan works on the Predictive Analytics team at Blue Cross Blue Shield of Tennessee, and he has received his PhD in quantitative psychology in 2011. Brennan's work focuses on developing machine learning and predictive analytics that address a variety of outcomes, including behavior change, clinical identification, and automation. He applies a variety of data science tools, including natural language processing, advanced machine learning, and software development. His work has been published in peer-review publications, professional publications, and in popular media. Nathan Funk is a SVP at Optum Advisory Services. Nathan has over 20 years of data management experience. Prior to joining the team at Optum, Nathan worked for 7 years as the Chief Architect of Community and State, or Medicaid, at United Health Group. During this time, he was responsible for Medicaid's architecture, medical quality, business analyses, and meaningful across the C&S landscape. At this time, I'd like to turn the floor over to our speakers.
Thank you, Catherine. This is John Case from Verado. Welcome, everybody, to the webinar. In a few minutes, I'll give Brandon and Nathan a little more time to introduce themselves, explain their roles, explain their background. I just wanted to quickly orient people to how we're going to approach this webinar. We're talking about, as the webinar title suggests, the role of referential matching in master data management. And we'll do that through a bit of a panel format. We've got some great speakers here from Blue Cross Blue Shield of Tennessee and Optum with some wonderful industry experience and insight. And so, I want to pick their brains on this topic and get some insight from them based on their experience in the industry. And so we'll give each of our speakers a little bit of time to introduce themselves. I'll take a few minutes to talk more about referential matching, explain what we mean by that, how it fits into the master data management, and then we'll do a panel discussion to get some more thoughts and insight from our speakers today. So with that, I'll ask Brandon to introduce himself here, and Brandon, just cue me when you want me to advance any slides.
Great. Thank you very much, John. And thank you to Verado for inviting me to come speak today. So as Catherine introduced, she did a very nice job of giving a little bit of my background. I'm a lead scientist for the Predictive Analytics team in our information delivery area. I build team strategy around advanced analytics, process improvement and skill development for the team, and also data reach. And I think a little bit of the conversation today will really circle around what data reach means from an analytics perspective. I've been trained as a quantitative psychologist, but spent the last 4 years really dedicated to advanced analytics, machine learning, artificial intelligence initiatives, specifically related to healthcare. Go ahead, John. Let's talk a little bit about the team that I'm on. Predictive Analytics really focuses on using statistical methods, advanced analytics techniques to understand how patterns in historical data help us to do things about the future, to predict things like early disease identification, or in my case, I built a lot of behavioral models, so looking at trying to identify members who might be more likely to respond to outreach. We thrive off of diversity and vast data sources, which creates interesting challenges when we talk about data matching. Predictive modeling is obviously not an absolute science, but our insights are really directed towards being proactive to help guide the business and to guide decision-making so that we are effectively utilizing the knowledge that we build from the understanding of patterns that we identify through our use of advanced analytics. Go ahead. So in short, what my team does is we really focus on trying to provide the business with state-of-the-industry analytics capabilities. So insights that help to mitigate disease progression, contain costs, creating business value by leveraging non-traditional data, which is largely where the natural language processing skills and techniques come in. We develop machine learning capabilities that help us to essentially get smarter over time, try and leverage more diverse data sets, and also understanding how other sources of data come together to give us a more complete picture of our members and help us do things more accurately in terms of predictive analytics and analytics that really help effectively balance our resources, our budget. So a lot of analytics we also deploy are internal to the business, and so they're built around process improvement and automation. Thank you.
Thanks, Brandon. Nathan, I'll ask you to give a little more background on yourself as well.
Absolutely, and John and everybody else, thank you for the opportunity to speak here today. So as was mentioned in the introduction, so I have the consulting practice, advisory services practice for Medicaid within Optum. Prior to that, I'm new to my role here within Optum, but prior to that, I did work for UHC, Community and State, within their Medicaid practice as the chief architect, as they mentioned, across that architecture, business analysis, business support, as well as the medical quality teams. And so with that, just kind of an explanation of where we used referential matching. We used it within our medical quality practices. And for folks that are familiar with medical quality, has a lot to do with the HEDIS metrics, prospective, retrospective, really how do you measure the effectiveness of your programs for your members? And us utilizing referential matching to be able to improve hit rates for members, be able to find claims, be able to look for labs, really looking at other ways to find information within this particular population. Something that we really pushed and really worked hard to be on the cutting edge with this, but being able to work specifically in Medicaid where you have a transient group, a transient membership, moves around quite a bit. It really works well, especially with information that you tend to get from programs. Sometimes being a little bit sparse, being able to fill in those gaps, again, with referential matching techniques. And then really taking a look at that kind of, oh, sorry, John, one sec. The other thing I was going to mention is we're also looking at other business cases, other ways to use this particular technology. But like I said, within that Medicaid population, really helping to fill in gaps for medical quality purposes. Go ahead, John. Thank you.
Yep, thanks. So what I thought I'd do before we get to having Brandon and Nathan kind of elaborate more on some of their insights and observations from their roles, I did want to take a few moments to talk more about referential matching. It's a in the context of master data management is a technology discipline that's been around for a while. It hasn't always gone by that name, but it's been around for quite a while, and a lot of folks on the phone are probably familiar with it. But the notion of referential matching is a bit newer to master data management, so I'll spend a few minutes talking about that. So as I mentioned in the introduction, I'm a senior solutions architect with Verado. Verado is a company that is using this referential matching approach to essentially improve what can be done in the discipline of master data management. And we do it through a cloud-based service. And there's really, at a high level, there's really two approaches to how you can use this referential matching in the context of master data management. One of those approaches is to actually augment master data management or master patient index solutions through something called an auto-steward process, essentially automatically stewarding the difficult matches that a typical master data management or MPI system would queue up for a data steward to look at. And there's another approach, which is actually just to use the Verado platform as a cloud-based master person index or master patient index to be able to identify matches and link data across systems. And we'll talk a little bit more about what that means. So when we talk about the notion of referential matching, it's really bringing together two different approaches that have been used historically by organizations inside of healthcare and outside of healthcare to try to deal with the problem of identifying people, members, patients, what have you, within very diverse data sets. So one of those approaches has been traditional master data management software, enterprise software, and it's a very algorithm-rich approach. Algorithms have been refined over the years to have more and more sophisticated fuzzy matching to be able to look at two membership records about a person and decide if they think it's the same person. There's also traditionally been a series of information provider companies that are very data rich. They build up a lot of information about people, and they try to use that information for different reasons. Sometimes it's marketing reasons, sometimes it's not. And what Verado's done is brought those things together to offer a solution of referential matching. It's bringing the algorithm experience of identity matching that comes from a master data management world along with the information-rich or data-rich environment of curating a data set much like you would from information providers. And so, when we look at that and how does that apply to being able to match identities across diverse data sets, one of the reasons that we look at this referential matching is that in our experience and from other studies, over 30% of demographic information about members is wrong. It's old, it's missing, it's sparse, it's incorrect. And this can be for a number of reasons. People's information changes over time. People's names can change as they get married and divorced. People move, their addresses change. That's a pretty natural thing. There can be errors in that information over time. Different spelling variations of your name get entered in different databases over time. Information gets mistyped. There can be ambiguities, use of nicknames, different cultural names get represented. Some cultures first name and last name, so it can get transposed in different databases. And then there's just incompleteness. Information can be missing. You can have sparse sources of data. You can have data that appears to not be sparse, but when you look at it, it's really just dummy default values that have been filled in to make the data look like it's richer than it is. And when you add all this up, what ends up happening is when you take a traditional matching approach where you're comparing two identity records against each other, all you're really dealing with is the data in those identity records. So, for example, if I have information about a patient from a claim, little green icons are supposed to represent attributes like names and addresses and birth dates about a person. And then I have information from another data source, say lab data. If that information doesn't line up well enough just based on those two pieces of information, then I can't confidently say it's the same person. The idea with referential matching is to build up a reference base of information about the U.S. population and use that to be able to get over this hurdle of 30% of data typically being old or incorrect, errored, missing. So to do that, the foundation is really to create a comprehensive database of identities, reference information across the U.S., preferably going back a long time, in our case going back 30 years. And that data is built up from a number of different orthogonal data sources that are independently verifying each other so that the data can be more trustworthy. And that information is constantly updated, and there's a huge amount of analysis and data science that goes into the process of building up that reference database. Done that, and you apply that reference database to this matching process. If we go back to the example before where you had an identity from a claim database and an identity from a lab database, rather than comparing those just directly to each other as you would in a normal MDM system, referential matching, you compare them to the reference database. And so the information that you have on one record may be different than the other. The claim may have a name and an address and a birth date, and the lab may have a name and a social security number and an address. And when you look across those, you don't have all that much information in common. One of them has a birth date, one doesn't. One has an SSN, one doesn't. But when you compare them to the reference database, each of them individually has enough information to be able to say, can I find the correct person in the reference database that's associated with this claim and that's associated with this lab record? And when you do that, then you can confidently say, you know what, these are the same people, even though the claim identity and the lab identity on their own didn't look similar enough. I can confirm that they both line up to the same person in this reference database. Now, when you can do that, there's a few very discrete ways that you can find matches and connections across data that you can't using a traditional approach without the referential matching. One of those is being able to see through sparse data. And data can be sparse either because you're comparing two data sources that don't have a lot of overlapping attributes, or it could be sparse because your data sources just have names and birth dates only. You can also see through errors. Being able to compare against a comprehensive reference database allows you to take in data that might be errored. It might have a typo in the birth date or a nickname that isn't obvious, but those can be resolved using a reference database so that you can say, you know what, I still know who this person is even though there's errors in the data that I'm looking at. Seeing through time is another example. Sometimes you may have a lot of information, but it spans a long period of time. And so as people move, as people potentially change their last names, if you're looking at an old version of someone's data and a new version of someone's data, you may not always be able to tell it's the same person. But when you have a reference database that has that whole history of name changes, address changes, et cetera, then you can see through time and be able to connect the dots to say, you know what, I know these are the same person. I know that Laura Smith from Chicago, Illinois, actually got married, changed her name to Laura Jones, and moved to New York. It's the same person, even though initially you might be looking at two records that look very different. And then the last example is being able to match by exclusion. We've got a comprehensive reference database of the U.S. population. You can narrow down to a particular identity in that reference database and rule out any other alternatives. This kind of goes hand in hand with sparse information. If all I've got is a name and a birth date, that in and of itself, I have two records with the same name and birth date. Not knowing anything else, I can't confidently say those are the same person. That generally gets you to about an 85 to 90% degree of confidence that you're dealing with the same person without the aid of reference data. But if you can go and look in a reference database and say, you know what, there's no one else close. There's no one else with that name or similar name born at that time in the population, now I can increase my confidence of that. So that's something interesting with referential matching. And the way you can actually leverage that and apply it to various business problems and technical problems, there's a few ways. One of which is just take an existing master data management system and simply make it better by plugging in referential matching to review the things that the MDM system couldn't match confidently. That's one possibility. There's another possibility of deploying this in cases where traditional master data management might not work. You might be dealing with different data sources or time frames that don't line up with what you can do with your MDM program. You can't take this new data source and search against your MDM system because it just doesn't match up with the data you already have. It's not a data source you're necessarily going to ingest into your MDM system, but you'd still like to do something meaningful with it in terms of matching it to other data that you have. And so that's an option to leverage a referential matching solution. And then there's a third option, which is you can actually use this as a standalone MDM or MPI system. I realize in the case of health insurance, most organizations have a master data management program already, so that's the first two scenarios there are really more relevant. So hopefully that was a useful primer or introduction to what do we mean when we're talking about referential matching and how it ties into master data management. So with that, I'd like to move into some additional questions for our speakers here. Let me start with you, Brandon. So you and I have talked a little bit in the past, and your team is kind of at the intersection of data management, data science, and business needs. So what are some of the benefits of being structured that way in terms of the flexibility it gives you for accomplishing your goals?
Yeah, so my team is certainly unique in that we have to work with multiple business unit data in various capacities. So that includes those who are our data managers, our database administrators, our data integration teams, as well as with some of our decision makers in terms of how we're getting that information and those insights that we pull from that information up to them. So some of the things that we've learned in that process is that we have to have a unique interaction with the data environments that we're allowed access to. And so on the management side, our administrators and our integration teams are constantly working with us to identify different solutions that allow us access to the data, but then also give us some of the freedom that we need to be able to pull that data together to enrich our understanding of any one individual. So in terms of matching, one of the things that we try and do when we build predictive analytics solutions is we try and bring together lots of diverse data sources. So obviously being in the managed care industry, our bread and butter is the claims data. But aside from that, we like to enrich the picture that we have of members by including all kinds of other data sources. And those data sources can either be data sources that we've purchased from third parties, or they can be data sources that we have through other business units, such as customer service or maybe marketing. And we try and bring that together where it makes sense for different use cases so that we have a more complete view of different attributes or features of a given member so that we can learn more and try and maybe predict more accurately what they may do in the future. So what this really means for us is that we create sort of unique relationships with our data integration teams as well as with our DBAs so that we're given the opportunity to understand sort of that matching process, understand how we can then apply it across those use cases, whereby some data sources may come in and be matched on some business information such as member number and group number, whereas some of those other cases would be matched on an actual master person index or master patient index like you refer to, so that way we can sort of build together the confidence that those matches or that those individual rows of data are indeed unique individuals and that that data does represent that individual. So some of the questions that we have to deal with on a daily basis in pursuing this kind of end is really identifying what kind of control we should have over leveraging different sources. And we solve a lot of these issues by sort of tightly integrating. So one of the biggest initiatives that was an organizational kind of restructure to be strategic in this way that really has enabled us to take each use case in stride is that the data integration teams used to be housed in our IT department, but now they're housed directly in our information delivery department, which is where my team is located. And so it opens up opportunities for us to communicate so that we can build those environments that we need to be able to deploy the types of analytics that provide the biggest impact for the business.
Thanks, Brendan. One of the things that you and I had talked about, prior to this was the challenge with dealing with clinical data. It might come from EMR systems or other sources, and that's something that's certainly increasing over time in the health insurance industry is connecting member-centric data, which health insurance has a lot of control over, with clinical data, which you obviously have a lot less control over. Can you talk a little bit about the challenge of tracking that member-level data and clinical data together?
Yeah, absolutely. So big initiative for us has been to do a better job of capturing a lot of those electronic medical records. And as we have gone down that road with various vendors, we've learned a lot about what that clinical data look like and what our solutions need to be able to bring it back into our environment and effectively relate it back to individuals as well as potential claims. What my team is largely tasked with in that project is understanding how the matching process enriches our understanding of the member and enriches our understanding of their actual medical interactions with providers. So what that means essentially is we go in and we look at whether or not there is a match between, say, a particular claim given on a certain date and maybe an EMR record that we have that's new in the database. We try and match on those things to see whether or not, at least in some level, they're lining up. We expect there to be some differences, obviously. And so where we see those matches, this gives us confidence in the data. This gives us confidence that those EMR records are indeed attributable to those individuals that our MPI process is trying to attach to them as the data integration teams bring them in. But then we're also looking at the ways in which that EMR information enriches our understanding of those medical interactions. So a lot of times what we learn is that, for example, providers will use lots of additional diagnosis codes and other things that they may not be getting paid for explicitly, but they want to keep record of. And so we don't see them in our claims database, but we see them in our EMRs. So one of the challenges that we really face is trying to understand both where the data can be used to ensure accuracy, that indeed that interaction is representative of a claim that we have somewhere in our database, but also the extent to which that information is enriching our understanding of those interactions and the degree to which we're confident that new information is indicative of that interaction as well as truly relatable to that individual. Some other things, another challenge that we're often working with that's related to the clinical data exchange project is really dealing with our vendor data. So clinical data exchange agreements, our EMRs, those rely on working with lots of different vendors who provide those solutions to providers. That problem is really exacerbated in the larger world of our enterprise, whereby we work with lots of different vendors who provide lots of different solutions to our members. And oftentimes my team is interested in capturing that information back in our own databases so that we can then go back and understand how to link that to existing member information so that we, again, enrich that image that we're having and enrich the opportunity to really understand member-level interactions. And so we're constantly working with our integration teams to identify those strategies with vendors through which we ensure that the data that we get back is the sort of the best quality that it can be for us to ensure that matching process is actually providing us with accurate data.
Thanks. Can you talk a little bit about, from a data science or predictive analytics perspective, what are some of the insights that that you try to draw out of data, or questions that you pose to the data that can be more difficult to solve because of the sparseness of some of the data sources?
So in a lot of cases, again, because my team is sort of in this unique position of trying to bring lots of diverse sources of information together. What we do is we identify that certain sources of information, either because we are unable to match at an individual level. So, for example, we capture web data, and a lot of the web data that we capture is really only attributable to the subscriber level, because we don't take information whenever individuals log into to our internal portal on the web. We don't take information that's individual level. They're really only required to provide their provider number, or their their subscriber number. And what that means is that if you have a subscriber number that's connected to, say, 4 or 5 individuals in a household, is that we don't know which individual from that household was actually using the web and looking up the different pieces of information that day that we're able to see. So that is one really good example of situations whereby we have to deal with either matches that are aggregated at different levels, or where we have situations where maybe we can match back to our individual member level information, but the data just isn't well representative of our population. So we have other solutions where we bring data back in from a vendor and say, for example, it's a specific sort of niche tool that we purchased, like a digital tool that we offer to members, but only a subset of our membership really uses them, maybe a very small percentage, say 1 or 2% even. That creates a sparse data problem. And so what we've done as a team is we've become really good consultants with the business in terms of identifying those sources of data, but also really coming to a good understanding of how well those sources of data can be matched back at the individual level, and then to what percent that they actually represent our population. And so we use those in different use cases. For predictive analytics, obviously, we want to have the most representative data. We want to have the least sparse data. Those produce the most accurate and predictive models. But there are other use cases that whereby we may do some very hyper-targeting, sort of around marketing campaigns or specific clinical outreach campaigns. In those situations, we may be able to enrich the data even more because we have sparse data, but that data is actually representative of that population. So we really take it on a use case basis, whereby we examine the degree to which the data that we're trying to pull together are matched, at what level they're matched. Are they matched at an individual level or a household level? And then how representative is that information of the population that we're trying to do something with, whether it be a campaign of some kind or some other form of outreach.
Excellent. Thank you, Brennan. Let me shift over to Nathan here and kind of pose a similar question. So in the beginning, Nathan, you started to talk about some specific sparse data challenges that you've actually dealt with in your past. Can you elaborate on challenges that you've faced specifically around sparse data?
Absolutely. And so as I mentioned before, with the Medicaid population, you've got a transient group of individuals, as they're working with health plans, as they're working with providers. Many times you have inaccurate addresses, old addresses, difficulty really matching up the information to make sure you have the correct person. And so really the sparse data challenges we had was that just seeing so many different identities, working sometimes across states, you had to be able to find and connect this information for, again, medical quality purposes. And so for our use cases, really using referential matching to fill in those gaps, being able to connect that information together, whether it was across labs with sparse provider data, whether it was across claims, delegated claims, other vendor partners, all of those things tied together to be able to really fill in the gaps and match for that Medicaid population. In seeing the history with all the history that's there with referential matching, you do get quite a bit where that Medicaid population will pop up from here to there, and different types and different sets of that information. And so, like I said, with the referential matching, really being able to fill those gaps in together. Go ahead, John.
And then, thanks. Yep, thanks. So, in terms of the challenges you face, you talked about it in the context of medical quality. What are some of the other things that you see in the industry where you could imagine using referential matching in the future beyond, already addressed in your own past?
So some of the other areas, other use cases we've looked into, the clinical ones for sure that were mentioned earlier, being able to tie those together, starting to look at that. Additionally, the social data, as you take that in, if you pull in other sources, being able to tie that back to an individual's record, again, within the Medicaid population, having that sparse data, you want to pull it back together. Really, those are two of the big ones. Other areas that you can pull together information across for care coordination needs, you look at some of your complex members, some of your non-traditional providers. Again, being able to pull that data together and match the sparse information sets to be able to make sure you can attach that back to the overall clinical record. That 360 view for care coordination purposes is a big spot.
Thanks. So I do see we've got some questions as well from audience. I wanted to kind of pose these as well. I've got some of my own thoughts. One of the questions is around, with this referential matching approach, are there limitations to how you would use this data? Some of it, referential data wouldn't have come from your members or subscribers directly to you. It would have come indirectly. In my own experience, I've seen that the emphasis of referential matching really is on matching. It's on being able to identify and make connections between different data sources, as opposed to taking the attribute values themselves from the reference data and using them for some purpose. I would think contacting a member, for example, would be a case where reference data, there may be additional address or name history that allows you to connect together a claim and a lab record that you wouldn't have otherwise, but that doesn't change the fact that, John Case signed up as John Case for his insurance, and so you're going to call him John Case. Is that kind of consistent, Nathan, with what you've seen or how you've thought about this use of referential matching?
Absolutely. I mean, even utilizing it for the purposes of connecting, we've had to go through audit processes with medical quality, speak with the auditors in the industry, and that's been the focus, is making sure you have that matching rate, making sure it's accurate, making sure you're using it for those purposes. When you're referring to that consumer, that member, it's not really a good thing to go back and say, I know this about you, if it's not something that you really have as part of that member's record. It's really focused, again, like you said, on those matching purposes.
Yep, absolutely. And then, Brennan, any thoughts to add on that question?
Yeah, I would just kind of emphasize the idea here that the data should be used in this case, really for what it was intended, which is to ensure high quality matching and the ability to pull disparate sources of data together in a way that that within the enterprise gives you insight on that individual. But anytime outreach is involved, or anytime individual materials are going out, it's really important, I think, not just from from a public relations perspective, but also even from a HIPAA perspective, that that information is really coming internally, that it's not coming from a third-party source, like in this case, a referential database, because as you suggested, John, the information that they provided us with is the information that they wanted us to have, and so it's important, for us, as as individuals who are interacting with this sensitive information, that we respect that. And so again, using this for what it's intended to use it for, which is really internal data quality, I think is really important and should kind of take precedence in those cases where you may feel as though you have more accurate information at your hand, and so you could more accurately get in touch with these people. But again, that comes with its its challenges legally and in terms of a relations issue.
Yep, absolutely. So one of the other questions that we got here from the field was, is there any reason that an organization wouldn't just use their existing MDM platform, assuming they have one, to solve the problems that we've talked about? And it's a good question. I think there's certainly scenarios where that is the right approach, right? That was the whole purpose of master data management. I think where the referential matching comes into the picture is when you're, again, I mentioned this earlier, either dealing with data sources that just don't quite fit well into the model of what you're doing in your MDM system, or maybe dealing with data sources where there's a sparseness or a quality challenge. Have you found that to be the case where there's been sort of, I guess, limitations to how far you can go with with current state of technology?
So I'll start that answer to that question, and then I'll hand it over to Nathan. But I think my team has had a lot of experience with this because our focus has been data enrichment and data reach, whereby we are concerned with really enriching the way in which we're able to understand our members. And so what that means is that while we do obviously rely significantly on the core of our business, the claims data, the data that from a data management perspective, we have very good quality checks in place to ensure that those claims data match with other enterprise data. Where we lose that control is when we're dealing with vendor data, and I think it's probably the case that a lot of vendors, or a lot of payers, may not necessarily have a lot of experience really thinking about the value of that vendor data, but my team is really, really interested and has, put a lot of effort and energy into bringing that information from vendors back into our systems, particularly when we find significant value or potential value in that data. And so then matching becomes really, really vital, because the vendor, essentially takes our information or takes information directly from our members, and oftentimes that's not standardized. That's out of our control. And so the information that they're bringing back to us, referential matching is a great use case whereby, if the data volume is large enough, we really want to ensure that what we're getting back is indeed representative of those individuals that we want to say they're representative of. So I think from that perspective, it's a really good use case on where a process like this could significantly improve the data management problem.
And so just to add on to that, for our purposes, we were able to get to a certain match rate with MDM and probabilistic and kind of those traditional approaches. Using referential matching techniques, it just increases that hit rate, that much more. So it's one of those things where, when you have the high value matching, pieces like Brendan was talking about, and then we're talking about within medical quality, where every gap close counts, you start to get those higher value matches, and just getting it to that next level, just like I said, increases your business value that much more. And so again, just to add on, that does make a difference between the traditional approaches. Back to you,
Thanks.
John.
And then we got one last question in the queue. Nathan had talked about the role of the referential matching in evaluating the program, working with auditors to evaluate the program. Can you speak to how often and how important it is for actuarial audiences to check the quality of matching for clinical program evaluation? Putting you on the spot here. I'm not sure how much you get involved in actuarial aspects of the business.
The medical quality rigors, the audit processes for folks that have been through those, very high bar, a very high degree of demonstration, a lot of questions, very specific on kind of how to get that through and make sure you understand the quality that you're bringing forward for matching. And like I said, it is a very high bar that you have to demonstrate. And it, like I said, for the folks that have been through audits before, it's a pretty fun and interesting process. Going through on the actuarial side, have not had to do that as part of this process. Just again, the medical quality has actually been one step higher, but it would be something as you go through your normal data quality practices, any of your warehouse or any of your data management processes, you'd want to demonstrate for them the matching capabilities. And like I said, we had to take it one notch higher for the auditors.
And I think the frequency part of the question is I think what I was hearing from you when you were talking about that is that it's not necessarily just a one-time thing. It's not like a one-time check and then you're done. It's periodically reevaluated.
Absolutely,
so
and you have different auditing.
That would be a good practice.
Absolutely. You keep that information, and again, for folks that are familiar with medical quality, you have different auditors for kind of each state that you're doing business in. So you do keep that, you do reuse it, and you're able to demonstrate that you have the most accurate matching and information possible.
Great. Thank you very much. So that's it for the questions. I'll go back one last time to the panelists here. Any kind of closing comments that you want to share with the group?
Maybe I'll take that first. So I thank everybody for the opportunity today. Really understanding this technology, understanding its approach, kind of where it fits in the life cycle of master data management and how to utilize this process. Hopefully you guys were able to see that with the use cases we talked about and what we demonstrated. Definitely look at the technology. There's a lot of different ways to use this, a lot of innovative approaches, other use cases even besides what we talked about and ways you can apply this. But like I said, just hopefully you guys learned something here and don't hesitate to follow up if there's anything else we can help you with.
I just want to
thank you for that.
Yeah, just like sorry. I just want to second what Nathan has said, and first thank you all for inviting me, and it's been a great conversation and opportunity to share some of the challenges that we face that are related. And I do understand that my team is a little bit unique in this way, in that we're not actually involved with directly managing the data, but rather we are very much involved with understanding those processes and really valuing the way in which our data management teams identify solutions that help get us to the most accurate insights that we can achieve. And so much of it has to do with really ensuring the data quality when you're pulling together different sources of data, that quality is really is up to a standard that gives you the opportunity, and from my team's perspective as analysts and as statistical modelers, to really understand, what the biggest impact, the biggest business value will be. So I think there's tremendous value here, particularly as you start to think about bringing in data sources that don't necessarily define the core of your business, that you don't necessarily have these solutions built around. I think these kinds of technologies produce some really interesting new ways of looking at bringing that information together. So thank you very much.
Thank you. And just thanks again to both of our industry panelists here. Your insights have been very, very helpful. And so with that, thanks everyone for joining. Catherine, I'll turn it back to you for any closing remarks.
Great. Thank you very much. Thank you, gentlemen, for that great presentation and for sharing your thoughts today. Thank you to our audience for participating in today's conference. That concludes this webinar. Thank you again, and enjoy the rest of your day.